Hi, Ofir. Can you please tell us more about yourself and Patternox and the great device that you have created?
So I'll tell you first about my origin. I'm a nuclear physicist and electrical engineer, and I get far from the hard physics into more electronics and electromagnetism, and my PhD in electro-optics. My mom got cancer, skin cancer, at more or less the last year of my PhD, and then I thought, when I finished all my obligation, I thought to build for her something that shows the underneath distortions, what's going on under the skin. And then back then it was kind of just an idea, but the last years I established other company, and then I found another patent. I had another patent. I found another new dogma or new direction to probe the upper surfaces. And I established this company, Patternox. And the idea is to be able to scan a small area and to understand what's going on under the skin, not relying on color, which happens at late stage, but relying on some precursor signs of deformities. It means that something is wrong in the tissue. It's not necessarily cancer, but this kind of deformities or atypia or dysplasia happens most of the time. It happens before it degrades into cancer. So instead of catching skin cancer per se in terms of color, we're trying to catch skin deformities, but much before it degrades into pigmentation. So it's a totally new dogma of how to look and how to probe skin deformities. It means it's also answer not just for skin cancer, but also for cosmetics. So if you have something here and you would like to understand that, what's the direction of it? Is it stay still as it is, or it become more and more dangerous or more and more ugly, let's say, in a very simple way. So a distorted lesion going nowhere. Dysplasia can degrade into neoplasm, which is mean it's cancer, but you would like to remove it anyway, from cosmetic reason or from dangerous and mortality. Okay. So this is the core of the idea, to catch deformities, which is a supergroup of abnormalities, and skin cancer is just subgroup of it. That's why we answer two fields, two areas, skin cancer and cosmetics.
Wonderful. And at what stage are you?
So let's go from the top. We have the idea, which is the patent. We finished with the provisional PCT national stage and IDS, which is article publication. And now we're about to get the granted, I hope next year. So this process is about 4 years. So we are at the end of it. So this is about the idea. About the prototype, I built the prototype myself, optics, electronics, design, algorithm, AI, which just happened. And we run the clinical trials at the Skin Center in Florida. We have about 500 lesions, but with 30,000 measurements, because each lesion we scan in different state of illumination or different state of polarization, and we extract 100 of images in different state. So it's not just 500 lesions. Yes, it's 500 lesions, but with thousands of measurements. Okay, and that's why I started to develop also an AI for pattern recognition, or more accurately, to give the level of risk according the patterns of the deformity. Now, random patterns is good, but when the patterns start to be directional, most of the time, like an explosion from the middle outward, it means it's something dangerous. It can be BCC, SCC, or melanoma, or it can be dysplasia, but high atypia, high deformation. Okay. The next step is to take the beta prototype, which now working at the skin center in Florida, and to convert it to a mass production. It means to tweak the software, to tweak the hardware. For example, I would like to make it wireless. At the meantime, this is here it is. This is the scanner. So the scanner today looks something like that with calibration and a scan button. But you see, it has a wires. It has 2 USBs. We would like to make it wireless with the docking, so it will be easier to use. Most of the dermatologists we work hate cables because they need to go around the patient. So, okay, we're going to do it wirelessly and to build a generic standalone scanner. So we'll be able to connect tablet, smartphone, and PC in kind of generic way, because I don't want to limit people. Okay, so this is the main purpose. For that, we have 3 milestones. The first one is $1.5 million. It's to convert the beta prototype into a DMR, device master record. After, of course, the software hardware tweaking, we're going to build a file for mass production, including, of course, regulation, VNV, QA, QR, and so forth. So this is the first milestone. It's technical milestone. The second one is the FDA. Once I have the DMR, means the ability to produce it in mass production, I need to submit, to do, of course, clinical trials, again, with the new model, and to submit it to the FDA. See, we are encountering the FDA 2 times, more or less. The first one is along the another small R&D, because most of the R&D we did, but this conversion from beta prototype into commercialized version. And then when we finish the clinical trials, which will be easy because we already did it a few times. The second milestone, it's another about $2 million, according to our calculation. Now, the third milestone is another $2 million. That's why the whole program is $5 million. But naturally, we're not looking for today the whole $5 million. I mean, if someone will put the money, I won't say no. But I'd rather to raise in portions, according milestones. So the first milestone, as I said, it's $1.5 million. But if somebody, let's say, will come with $3 million, it will be the best. This is the sweet point, because it will take me to mass production and FDA. And then to raise another $2 million, it's much more easier, and the valuation of the company will elevate 2-3 times. But today we're talking about 1.5, and I present it as up to 5.
Mm-hmm. Wonderful. And I understand it's not your first rodeo with fundraising. You have successfully concluded an exit before. But with this particular project, what have you seen as major fundraising struggles? What was the toughest for you?
I think that the risk of medical device, people afraid from regulation part, because technical stuff, it's more or less deterministic. Of course, there is some hurdles there as well. But the part of the FDA, you don't know exactly how the examiner at the FDA part will refer your scanner. That's why we're doing regulatory strategy. So we took a professional company which already done it a few times, and we check what kind of regulation notes we need to stand and what level. So we're aiming to class 1 for cosmetics and class 2 for professional use. But I mean, there is class 3. I mean, class 3 it's also reasonable. People invest in class 3, but class 3 is more cumbersome, right? I mean, especially for pills or chemistry, anything that has to do with chemistry and pills. It's like 17 years. The average is 70 years. For medical devices, can be 4 years. We believe in our case, because there is predicates and we check what kind of level we fit to. So it calls, I think, sequential equivalence, something like that. So we're aiming to, the highest is class 2. And the process, if everything went well, it's about 9 months or a year, which again, we're talking about the whole frame, the DMR and the FDA in the frame of 2 years. It's very reasonable for class 2. And maybe we'll get class 1, so it will be even shorter. But the regulation, I think, scared people.
Right. And when did you first hear about the GLC? Because I know you've been doing your due diligence and your thought process took a long time. So when did you first hear about the GLC, and what actually made you decide to join after all this time?
I think it's you and Lena, that we connect somehow through LinkedIn, because we haven't commenced the seed round because of the political issues, and we would like to finish to do something with the clinical trials we're running, so we postpone it a bit. But I'm trying to probe the network, to see who is doing what. And somehow I think we connected, I to you or you to me, I don't remember really, but I think it was through LinkedIn. And then we had some Zooms, and I said, okay, let's try it. If the price is reasonable and I can meet in 2 sessions or whatever, we had some reasonable and I think fair agreement compared to others, of course. That's why I give it a shot.
And what expectations did you have before attending your first gathering?
Well, I think I'm 51 and I'm not expecting. I let the world, do its own thing. I'm trying to be good and to be fair and to offer something which is worthy, And then I let the world, to do his own act, his own thing. So I didn't have expectation. I check it, and I saw that at the Zoom rooms, the meeting rooms, during the sessions, I saw some people apply to me. So I said, okay, maybe it's working, And lately, last session, one of the investors actually invested, not a lot, but he invested $25,000, which is a nice beginning, just to be one of us. I believe he wants to check us to see how we act. And he said that if it will be make sense to him in the future, maybe he will invest more. Mm-hmm. But this small money enable us to move forward, maybe to another sessions, to meet another investors. Okay, I mean, it's a statistical thing, and nobody promised you anything. So I'm not expecting from anybody anything. I do expect that the conference will give birth to some investments, of course. But before that, I expected people apply to us and feel comfortable to use this platform, your platform, to apply to investors. So I have a basic expectation, which is reasonable, that the website will work and the Zoom won't stuck, in the middle of the Zoom meeting, but not more than that.
All right. Well, congratulations. I think it was your third gathering.
Third? Yeah, maybe.
Gathering. So great result.
Thank you. I won't clap to myself.
Well, it's a start. It's a start. But how? Obviously, you had an idea, right? So there will be a gathering for investors, a panel discussion, and then you'll have a time to present and conduct one-to-one meetings. But mm-hmm. How was the whole event experience for you? Was it easy? Was it convenient?
Yeah. It was really good. I mean, compared to others, The fluent or in the breaks, which you use between meeting rooms, it helps. So I just keep doing this. I would maybe expect, or I would want, not expect, I would want, more people to know about me before the meetings, and maybe if you can help us at the background and to send people a cover page, or just to push and to do kind of a lobby for us, this might help. But again, I'm not a prophet. I just think that sometimes investors need another person, another mediator, to mediate between the opportunity and the investment. So maybe you can push this.
We are indeed doing that if someone is organizing a tailored event, which is bespoke. So certainly we reach out to investors in advance. When you're presenting at a general gathering, you have general exposure. So certainly it's still an option for you, Ofir. And what would you recommend to someone who is, another startup founder, perhaps in a healthcare space or another space? What would you recommend, one or several things to them before or when they're considering joining, and when they're getting ready to present to investors and meet with investors?
After you review what the standout at the Silicon Valley, and there is some Y Combinator and SlideBean and DreamyDose, and you see the conventional format of a bunch of slides. Write a summary for each slide and practice in front of a camera or a mirror. You need to practice up to a stage that you feel it come natural to you. I'm not saying I already got to this point, but that's what I'm doing. And from a long slides, you need to shrink it up to 4 or 5 minutes, right? And actually, I have a kind of a format I set to myself, and in this format, I split it to 3 areas, which is the idea, the idea, the market, or the financial, and then the opportunity. I split it to 3 portions. Each portion has a few slides, but it's issues which I feel comfortable. Sometimes I give it to a finder, for example, which help us to find investors, and he or she doesn't feel comfortable with my slide. So I tell them, you know what, change them, because it's more important for me that you will feel comfortable with it. Because once you meet an investor, you are the face of the company. So you need to feel comfortable with it. But again, if you present the company, practice for days, sometimes 4 minutes. Took me a whole week to practice, to be fluent with conveying the idea. I'm not kidding. It's really repetitive work, and anyway, for me it took more than a week to feel comfortable with my own slides. Okay, so this is one. The second one is try to build your own website. Go to Wix or any other automatic HTML, and try to think as an investor. And now I invested myself in about 12 investments, small one. But I'm trying to convey the idea in a transparent way, as I expect people will do to me. Okay, so I'm trying to do things easy. So what I did, I built one of the link. You have an offer for investors, and you have there everything. You have the one pager, the pitch deck, the clinical trials, results of the clinical trials, and also a video, a pitch video. So I won't have to send, the one pager and then the pitch deck and then the clinical trials result and then maybe a video, and then the business plan, and so on. And put everything in one place, make it, in order, in a reasonable way, and let the investors, dive in as much as they want. So that's the two things that popped to my mind.
Wonderful. Thank you so much, Ofir. That's valuable. And would you recommend JLC as an investors community for someone who is raising capital and trying to get in front of investors?
Yeah, in my short experience, it was nice, fluent, very friendly. You were doing this wonderfully. Keep the price reasonable. People will come. Really, you did it with me. You can choose if to say it or not, but the price we decide between us for 2 meetings, it makes sense, because the average of it, if I split it, I found it in other sessions like this. So it makes sense.
Mm-hmm. And how was JLC experience different from any other places you've pitched at?
I think the way you manage it and the way you enable investors know more about the opportunity. I mean, the mediation part, the part of the lobby you're doing to us, probably work. Again, I just started with this. 2-3 meetings. It's not a lot, but I think the mediation. I mean, how you convey the idea, how you manage the session, the options of getting a bit relaxed and then get back to the rooms. I think it makes sense. It's also comfortable for the investors to digest what they just heard.
Thank you very much, Ofir, for your kind words. And thank you for explaining more about your project. I wish you nothing but the best. I think what you have created is something really important to have, in literally any household, right? But for sure, for the skin doctors, dermatologists, it's really important. So again, thank you for working on it and for keeping your spirits up and high and actually delivering and seeing this through.
Thank you. Thanks a lot. Great.
Thank you.
Great.